Welcome to Mercy Medical Center's live webinar. Today's topic is Helping Kids Cope, Understanding Adverse Childhood Experiences, or ACEs. Joining us today is Alyssa Drury, counselor at Mercy Family Counseling. After a discussion, she will take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow, and your questions will be confidential. Welcome to the webinar, Alyssa. I'm really glad to have you with us here today. I'm going to turn the mic over to you now so we can go ahead and get started.
Thank you, Lynn. As Lynn said, my name is Alyssa Drury, and I'm a counselor with Mercy Family Counseling. And what I'm going to talk to you about today is adverse childhood experiences, which I will also refer to as ACEs throughout the presentation today. So what are adverse childhood experiences? Well, most people intuitively know that our childhood experiences shape our adult lives. This is the basis of what ACEs are. Adverse childhood experiences are broadly defined as incidents during childhood, and that means from age 0 to 18, that harm social, cognitive, and emotional functioning. Frequent or prolonged exposure to such events creates toxic stress, which I will talk about a little more about later on. This toxic stress then damages the architecture of the developing brain. When we're children, we're growing physically, mentally, and emotionally. We depend on adults to teach us and model for us the behaviors that will help us thrive better in life. For many children, these adverse childhood experiences get in the way of this, and they influence how we develop, even how our brain develops physically. If we don't have a safe, nurturing environment, we develop differently than if we did have one. The consequences affect our physical health and our mental health. These negative outcomes are very serious. They can include diabetes, high blood pressure, heart disease, depression, smoking, overeating, alcoholism, drug use, and early death. There is now research-based evidence that shows that the more ACEs a person experiences, the more likely poor health outcomes become as an adult. From 1995 to 1997, investigators Robert Anda and Vincent Folletti conducted ACEs research. They surveyed more than 17,000 people about their childhood exposure to the 9 ACEs. The results, combined with the findings of physical exams and ongoing tracking of their health experiences, strongly documented the link between adverse childhood experiences and negative health and behavioral outcomes later in life. Ongoing research by the Center for Disease Control also finds that, in the worst case, trauma in childhood could take as many as 20 years off life expectancy. So adverse childhood experiences don't guarantee bad outcomes for adults, but they increase the odds of struggle. And they're largely preventable also. So now I'd like to go through what are the 9 ACEs that was asked about on the surveys and the research that was done. And remember, these questions pertain to the participants' first 18 years of their life. So the first one is physical abuse, and they defined that and asked participants, often were you pushed, grabbed, slapped, or had something thrown at you, or an adult in the household ever hit you so hard that you had marks or were injured? The second one is emotional abuse, and they asked, often or very often, a parent or other adult in the household swore at you, insulted you, or put you down, and sometimes often acted in a way that made you think you might be physically hurt. The third one is sexual abuse, and they asked, an adult or person at least 5 years older ever touched you in a sexual way, or had you touch their body in a sexual way, or attempted or actually had any type of intercourse with you. The fourth one is addiction in the household, and they asked, have you ever lived with anyone who has a problem drinker or alcoholic, or lived with anyone who used street drugs? The fifth one here is incarcerated household member, and that is just defined as any household member who went to prison. Number 6 is mental illness in the home. If a household member was depressed or mentally ill, or if a household member attempted suicide. Number 7 is violence towards the mother. If your mother or stepmother was pushed, grabbed, slapped, or had something thrown at her and or kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few times, or ever threatened or hurt by a knife or a gun. Number 8 is one or no parents. This is if parents were ever separated or divorced. This can also include the absence of one or both parents. And I'll talk a little bit more about that one with a specific case here in a little bit. The last one, number 9, is neglect, and this includes emotional and physical neglect. For emotional neglect, the respondents were asked whether their family made them feel special, loved, and if their family was a source of strength, support, and protection. And for physical neglect, respondents were asked whether there was enough to eat, if their parents' drinking interfered with their care, if they ever wore dirty clothes, and if there was someone there to take them to the doctor when they needed to go. So those are the 9 ACEs. This next slide here is a slide of a brain scan of a normal 3-year-old, and then a brain scan of another 3-year-old who has suffered from extreme neglect at age 3. This really shows the physical implications on the growing brain, and this is only at age 3. Some people find this fairly disturbing to see. But because the brain structure changes, this affects all areas of a person, how they regulate their emotions, how they think, how they cope with stress, etc. Another interesting fact is that even while in the mother's womb, these adverse childhood experiences can affect a fetus. If the mother is under extreme toxic stress, this also affects the baby in the womb. So if the mother is getting emotionally abused, physically abused, sexually abused, the baby can feel that being inside the mother. So the effects of ACEs can begin even before we're born. This next slide here, this kind of gives us an idea of the cumulative effect that it has on us. So there's, on the left-hand side there's heart disease listed, smoker, alcoholic, suicide attempts, and IV drug user. And then at the top of the chart, there's 3 different columns. One is the likelihood of someone developing these things with either no ACEs, or 1 to 3 ACEs, or 4 to 8 ACEs. So if we look at an alcoholic, for example, someone with no ACEs has a 1 in 69 chance of becoming alcoholic. That significantly goes up for the 1 to 3 ACEs, where it goes to your 1 in 9. And then 4 to 8 ACEs is 1 in 6. Suicide attempt, that's another one that's pretty striking to me. If you have experienced no ACEs, you're 1 in 96 likely to attempt suicide, versus if you've experienced between 4 and 8 of the ACEs, it goes to you're more likely 1 in 5 people to attempt suicide. So I just wanted to show this slide a little bit here because it shows how severely those chances increase with the more ACEs you've experienced. Toxic stress. I'll talk about that a little bit here. One of the keys to toxic stress versus normal daily stress is that it is excessive and it occurs over a long period of time. So an important part of our child development is learning to cope with stress. When we're threatened, our bodies prepare us to respond by increasing our heart rate, increasing our blood pressure, and our stress hormones. When a young child's stress response system is activated within an environment of supportive adult relationships, these physiological effects, the increased heart rate, the increased blood pressure, increased stress hormones, those are buffered and they're brought back down to baseline. The result is the development of healthy stress response systems, a child learning how to actively cope with stress when they have supportive adults in their lives to help them. Toxic stress occurs when a child experiences strong, frequent, and or prolonged adversity without adequate adult support, where there are not adults to teach the child or reassure the child that they are safe. When someone experiences, for example, using one of the ACEs, long-term emotional abuse, for each incident that occurs, the brain automatically releases cortisol, which is what we call our stress hormone. Cortisol is produced in response to a trauma as a protection for us, just like when our heart rate increases, our blood pressure increases. Our body is trying to protect us. So this increased cortisol production over a period of time kills nerve cells. Now, if a child is dealing with multiple ACEs, for example, physical abuse, emotional abuse, witnessing or hearing his or her mother being abused, this increases the number of times the cortisol is produced and released, which results in an increase of nerve cells killed. This, in turn, leads to poor brain development and altered brain structure. Not only does it affect the brain, but it also affects other organs in the body. This increases the risk for stress-related disease and cognitive impairment. The more adverse childhood experiences, the greater the likelihood of developmental delays and later health problems, including heart disease, diabetes, substance abuse, and depression. This is a diagram that represents what a person goes through in life when these ACEs are present. This is what is called the ACE pyramid, and this one has 6 layers. As I go through this with you, I'm going to talk about a patient that I've worked with who I will call Amy, and how she's experienced, some examples of how she's experienced each level of this pyramid in her life. So let's start with the bottom layer. The bottom layer represents the adverse childhood experiences, the 9 ACEs that I went over initially in the presentation. So let's first identify how many ACEs my patient Amy has experienced. Number 1, physical abuse. She suffered recurrent physical abuse as a child from her biological father, her siblings, her stepfather, and other men in her life up through age 18. She's also witnessed traumatic physical abuse by others towards her mother and siblings by her father and stepfather. The second adverse childhood experience is emotional abuse. Amy suffered recurrent emotional abuse from the previously mentioned individuals. She was called ugly, stupid, told she will never get anywhere in life. If she was hungry and asked for food, she was ordered to sit in a chair and face the refrigerator for days at a time with a padlock on it. The third one is sexual abuse. Amy was sexually abused and raped by her biological father starting around age 4 or 5. She was also sexually abused by her older brother. Even after age 18, in her early 20s, she was raped by multiple different men in horrific ways. Number 4 is having an addiction in the household. Her mother was an alcoholic. Every Friday, her mother would take all 4 kids with her to the bar after they got home from school. She remembers looking forward to this because the staff would give them free pop while their mother drank and interacted with others in the bar. Amy drank her first beer at age 5, along with her brother. The 5th ACEs is incarcerated household member, and she did not have this adverse childhood experience. No one in the household was ever incarcerated for Amy. The 6th one is chronically depressed, mentally ill household member. Amy's father was mentally ill. She remembers him telling them that her mother was lying dead in a dumpster in Cedar Rapids somewhere, and so they lived in a small town outside of Cedar Rapids, and so he took them in the middle of the night, and they hitchhiked to Cedar Rapids, and he had them help him go up and down the alleys and look in the dumpsters for their mother. The 7th ACE is The mother is treated violently. She witnessed her father and stepfather physically harm her mother. She's also seen her father hold a gun up to her mother's head. The eighth one is one or no parents. When she was around 6, her father woke them up in the middle of the night and had them walk to a town about 10 miles away to go to a babysitter's house. He told them that he and their mother would be back to get them. They never came back to get them. The babysitter ended up notifying authorities, and they were put into the foster care system. And then the ninth ACE is emotional or physical neglect. And again, she was neglected in many ways. Her mother was always gone, and the kids were left to take care of themselves. When she did reach out to a teacher or social workers at school, she was told, "What happened stays at home," or "Your dad loves you, he wouldn't do that." And of course, that's from her perspective. The next layer in the pyramid is disrupted neurodevelopment. If we think of Amy, she's experienced 8 out of the 9 ACEs. All of these experiences have had a huge impact on her neurodevelopment. If we think about it, we're little children and we're growing and developing our bodies, our minds, our brains. When a child lives with things like Amy has survived through, how can she develop, quote unquote, normally or healthy compared to someone who has had a loving, nurturing, good role modeling behavior by their caretakers? How can her physical health be good? What is her stress level on a daily basis? All of these things contribute to the disruption of the neurodevelopment. It's like she has grown up in one world and then as an adult is expected to live in another. The third layer of the pyramid is social, emotional, and cognitive impairment. As Amy developed, she began having social problems. She was bullied severely in high school. She did not know how to regulate her emotions, so when she did experience emotions, they were very to the extreme and very intense. The impairment to her brain developing severely interfered with her thinking processes, her impulsivity, and her decision making. And it still does to this day, and she's currently age 35. The fourth layer is adoption of health risk behaviors. Again, Amy began having sex with multiple different boys. She began using alcohol and drugs. She found herself in more abusive relationships and abusive friendships. So like I said, she's now 35 years old, and she is working on herself. I've worked with her for about a year now. She's made a lot of progress, but is still has a ways to go. The next one in the pyramid is disease, disability, and social problems. Again, my example, Amy, she gets so intensely attached to other people. She will text someone 50 to 75 times a day, almost, to one person. She doesn't anymore, but she used to. She doesn't know what a healthy adult friendship is like, because all she's ever done is give to other people so they won't abandon her like her parents did to her. So now she's working on things. She's learning things that she needed to learn when she was 11 or 12 or even 5 or 6. And so this is where her case stops in the pyramid, because the last stage is early death. Early death may come from leading a life of risk-taking, like the substance abusing, not taking care of your body, making poor choices, putting ourselves in unsafe situations, not taking care of our physical health, going to the dentist, feeling so depressed and hopeless that we want to commit suicide, and the stress takes a toll on our bodies. These next 3 slides, I apologize if they're fuzzy, but it's the clearest I could get them. This is, again, based on some of the research that Dr. Anda has done. And this slide here talks about the ACEs, comparing that to adult alcoholism. And you can see on the bottom, as the ACE score goes up, if you have more ACEs, the higher percentage of likelihood that you will become alcoholic. So, if you look at the pink or purple where it has number 4 on it, that's 4 ACEs, 4 or more ACEs, and that's so much more likely to become alcoholic versus even having 1 or 2 ACEs. This next one, again, is comparing attempted suicide. As you see the ACEs go up, the graph goes up, the more likelihood one person is at attempting suicide. And then here's just one last example, risk of depression in adult women who have experienced adverse childhood experiences. And again, it looks similar to the other ones. It just increases as the more ACEs are experienced. Okay, so ACEs in Iowa. Iowa advocates, they're starting to explore the prevalence of ACEs, but we already know that the Iowa adult population has health problems strongly associated with ACEs because they've done some national studies. In the fall of 2013, I've been told that there are going to be more specific, Iowa-specific research findings coming out, which will be very interesting to look at. So that should be coming soon. But from the national studies that have already been done and the data that's been collected, here are just some of the statistics they found specific to Iowa. 66% were overweight or obese. 8% were told they were diabetic, and another 6% pre-diabetic. 8% had cardiovascular disease. 16% were smokers. 23% were former smokers. 5% were heavy drinkers, and 17% were binge drinkers. And again, these are all based on experiencing the 9 ACEs in childhood. A few more statistics from those studies: $738 million in healthcare costs for adult obesity, specifically in Iowa. $1.34 billion for cardiovascular health conditions, and over $1.5 billion cost of diabetes. The good news is that many of the effects of ACEs are largely preventable. Obviously, the most effective prevention is to reduce young children's exposure to these extremely stressful conditions. But there's also research that shows, even under stressful conditions, that supportive, responsive relationships with caring adults as early in life as possible can prevent or reverse the damaging effects of toxic stress, which can be created by experiencing these ACEs. This means that even if at home there are not supportive and responsive adults, others in the community can fill that role, such as teachers, doctors, a neighbor. In addition, there are other factors that can also help minimize the damage from ACEs. These factors, like I just said, one of them is caring relationships with parents or extended family or other caring adults. Having good health and a history of adequate development can help. Having good peer relationships, having hobbies and interests, having active coping skills that are helpful, positive self-esteem, good social skills, easy temperament, a balance between seeking help and seeking individuality, and having an internal locus of control. And that means that when one believes they have control over themselves and how they think about things that happen in their life. If they feel that they don't, or if they believe that they don't have control, then they're not going to be able to overcome this as easy. So what else can we do to help? Support programs and services and policies that help protect children. Be a good neighbor. Talk to your neighbors. Reach out to those that might be struggling. Volunteer your time and skills. Be a mentor. Raise awareness just by talking with other people about it. If you hear or see family violence, report it. Don't ignore it. Be a nurturing parent. Spend time with your children. Be encouraging. Set clear boundaries and consistent rules. Make sure your child knows you love him or her. Learn ways to positively manage your own stress and your anger. And don't accept violence in your home. So ACEs in Iowa, what is the next step? This year, health planners in Iowa, meaning the Iowa Department of Public Health, added specific ACEs-related questions to an annual state health survey that is conducted by the Center for Disease Control. The survey is called the Behavioral Risk Factor Surveillance System, and it is believed to be a timely and accurate source of Iowa data on health risk behaviors. Also, it's an accurate source for Iowa data on preventive health practices, healthcare access, and primarily those related to chronic disease and injury. And as I mentioned earlier, these responses and the data from this will be available in the fall of 2013. In addition to this, and probably as a result of the data that will be released, we are predicting that there will be more concrete changes in programs and services. The concept of ACEs is not brand new to those of us in the helping professions, but the research and the data is confirming what we already thought. It's great that ACEs is becoming more and more a part of conversations. And this is not just happening in the United States. It's spreading around the world. I was just attending a conference at Mercy Medical Center on ACEs recently, and the presenters, Dr. Anda and Laura Porter, included a slide of the Dalai Lama in a meeting, and up on the screen was ACEs, and they were talking about adverse childhood experiences and learning what they are. So it is spreading around the world. So with ACEs, prevention is the key, to start when children are young. On another level, there are still going to be those people that we cannot prevent this from happening to, and we will have to still be there to help them when they're adults and they want to seek help for the trauma they've suffered through in their life when they finally decide they want some help. So there are still going to be those people that those of us in the helping professions are going to help as adults. But if we can work on limiting those 9 childhood adverse experiences, that is going to greatly help those children's lives and their ability to function better as adults. So on this next slide here is some resources. The first link here is to the research data that was done on ACEs that Dr. Anda did. And then the next link is for Dr. Anda's website. And then for more Iowa-specific information, there's the United Way of East Central Iowa. They're keeping a lot of data. They've put out brochures and different handouts on ACEs also. So please utilize these. And this is where I got some of my information that I presented today.
Well, thank you, Alyssa. Wonderful information about this very serious topic. To remind you, questions can be submitted from the box in the upper right-hand corner of your screen. And again, if you can't see it, click on the orange box with the white arrow. Get to our first question here in a minute, if we can get the screen to working for us. We know we have questions out there, so just bear with us here. We got a little technical difficulty. Our first question, are children who have been exposed to ACEs more likely to suffer from PTSD, post-traumatic stress disorder, as adults? What's the relationship there?
From my experience, there's a very strong relationship there because post-traumatic stress disorder is, symptoms that come from a trauma that someone's gone through or multiple traumas. So in my experience and working in the field for 15, 16 years now, I've really found a lot of childhood trauma that carries on into adulthood in the form of post-traumatic stress disorder.
Okay, we have our program working here again now better. I can get to the next question. For the ACEs in the Iowa section, where did the data come from that shows ACEs and the subsequent health effects? Okay, this is for the ACEs in your Iowa section. Do you have that information?
Yes, I did get that information. I got it from the United Way of East Central Iowa in a handout that I had where they had summarized some of that and given some of those statistics.
Our questions are just coming in like crazy here, and our computers just be a little touchy, so bear with us here. Okay. Alyssa, can you explain how foster parents can help?
Yes, I think that foster parents can have a huge impact on children that they're fostering, because if the children do come from homes that are unstable or violent, or where these children are experiencing some of these ACEs, I think one of the most important things is to just be a positive role model, to try and teach them how to deal with stress, how to process and express emotions appropriately, and to be a positive adult in their life that they know that they can go to for anything.
Okay, next question. If one believes they have ACEs, what do you suggest would be the first step to get help?
I would suggest that you go see a counselor, or you can start initially with your primary doctor if you have a regular family doctor, and they can refer you to a counselor or a therapist that kind of specializes in this area. You can also go to a psychiatrist. They would be, dealing with medications if that's something that you're interested in. But if you're wondering, where to start, you can call your regular doctor, and they could give you some suggestions of counselors or therapists that may specialize in this.
Next question. Is there any difference between male or female children and how ACEs affects them? Good question.
At this point, I haven't found any data that separates male or female. That's why I'm very interested in seeing these Iowa-specific statistics come out in the fall of 2013. I know I'm having some conversations with some of my coworkers about if there isn't some of that data, that we can do some more studies ourselves and gather that research. I actually do work at the Catherine McCauley Center a couple days a week, and that's a homeless shelter for women. And so me and Jennifer, my coworker, have talked about the possibility of getting some specific data like that, if that's not included in the statistics that are coming out in the fall.
Regarding the brain damage caused by neglect, can that damage be reversed?
I'm assuming you're talking about the physical damage of the brain. And I'm not a physician, so I don't know exactly, but my guess would be that if there is those supportive adults in their life, as soon as a child can have those in their life and have that consistency, then my guess is that some of that may be able to be reversed. Maybe not all of it. And again, I'm not a physician, so I can't tell you specific or 100%.
Next question is, are some children more resilient than others in their ability to recover or cope with ACEs? And again, if so, why is that?
In my experience, I've seen that there are some children, or even the children as adults, are more resilient and their ability to recover. In general, I think children are very resilient because they're growing, they're developing, and there's more of a chance to add some of these supportive adults in their life when they're younger versus than older. And so as far as why they're more resilient, it's my opinion that some of us just have more resilience, or there's different qualities of our personalities or ability to cope and recover compared to other people that don't naturally have that.
Another question here regarding the survey. How is data collected on ACEs, and was it by survey?
Yes, it was by survey. It is by survey. As I said, they're incorporating some of those questions for the Iowa data in the behavioral risk factor surveillance system, where they're sending out surveys specifically for Iowa. On the national level, I believe, Dr. Anda, they surveyed by paper and or questions, or verbally, 17,000 people who were enrolled in a certain health insurance plan. That's where they received most of their data.
Okay, next question. Can you explain why the risk of heart disease goes up when a child has been exposed to more ACEs? We can see the emotional, but it's interesting to look at the heart disease risk.
As far as the physical implications of ACEs, and heart disease is one of those, as we're growing up as children and we're experiencing these ACEs, if we're hurt or we're physically injured and we're not taken to the doctor, that can be a factor. Another factor can be not having good nutrition if you're not being fed by a family member at home, or not getting to the dentist and having your teeth clean, or if you've got a lot of the stress and all these multiple traumatic events are going on as you get older, you really just kind of put your physical health aside because you're just trying to survive throughout each day. Even as an adult, if this stuff is still really interfering in your life, you're still just trying to get through each day.
I'm concerned my granddaughter is being exposed to violence in her home. What can I do as her grandmother, or at least where can I go to get more information?
Well, number one, I think if there is physical evidence that you see any bruises or scratches, definitely you can call the Department of Human Services and tell them what's going on, and they will decide if they need to investigate it as a case or not. Another thing you can do, if you feel like there's something happening, you can also call the police, and they can stop at the house and do what we call a welfare check to make sure things are okay at home. And another thing, too, I think, is as many consistent, supportive, responsible adults that are in her life, that you can get in her life, the better. Whether that's teachers at school, whether that's you yourself as the grandmother, or the doctors or neighbors.
Okay, we've had a couple questions coming in here, and I moved my slides around in an attempt to get back to the slide that we wanted, that had a couple of people that had specific information for Alyssa, and if you do, Alyssa can be reached at the number on your screen, 319-398-6575. I know we've had a couple people that had to leave us, and we will be archiving this webinar also, and it will be available at our website, mercycare.org/live, and usually by the end of the day or within the next couple days for sure, you'll be able to listen to this in its entirety. Another question. Your example of Amy seems to be an extreme situation. How often do you see patients suffering from ACEs in your practice?
Yes, the examples I gave of Amy were fairly extreme. This is not too much of a typical case, but I wanted to use those examples for this presentation. Like I was saying earlier, I work at Mercy Family Counseling 3 days a week, just doing outpatient counseling with all different types of people. And I actually do deal with this quite a bit because I've kind of developed this as a specialty of mine in dealing with trauma in people's lives and how to overcome it. I see it a lot more at the Catherine McCauley Center, where we're dealing with women who have had a lifetime, a very long lifetime of trauma, and so I deal with that most of the day on the 2 days a week that I'm at the Catherine McCauley Center.
Next question is, I know it's important to learn about ACEs, and you talked about programs in Iowa, but what's being done in Cedar Rapids specific?
Well, I know people they're getting together, they're talking about this. Like I said earlier, we recently had Dr. Anda come speak at Mercy Medical Center. I see here on the screen that he may be coming to Cedar Rapids again in September. That's great. As much, as a part of this you can be to just join the conversations, talk about it, inform people about it, on a community member level, please do that. So I think, if you can get in contact with Lynn County or United Way, those are a couple of the key organizations that are really involved in this and have the most up-to-date information. And I'd like to say that we are at Mercy too, because we are talking about it a lot. So just please reach out and see what you can do if they need help or just to be able to attend these events.
Again, as I mentioned earlier, this webinar will be available at mercycare.org/live. If you or a colleague weren't able to, if you had you obviously are listening, but if you had a colleague that couldn't listen to it, it will be available there. Our next webinar is Osteoporosis, the Silent Disease with Luann Weber. This will be Thursday, May 9th at noon to 1. And again, she will take questions live after her discussion. The second webinar in May is Manage Your Stress and Sleep Better. And this is with Megan Esch, another counselor at Mercy Family Counseling. And her webinar will be Thursday, May 30th at noon to 1. And again, she will take questions live after the discussion. Now, if you're interested in future Mercy webinars or other events, you can sign up for Mercy's electronic newsletter at www.mercycare.org/e-news. I'm just going to check. I believe we have covered all the questions that were submitted to us today. But again, if you have additional questions and want to reach out to Alyssa, she can be reached at 319-398-6575. Thank you all for joining us today.